Hi, intravitreal injection is a procedure in which a medication is injected directly into the vitreous cavity using a very fine needle. The vitreous cavity is the gel-filled space inside the eye. Intravitreal injection is given for macular edema. Macular edema means swelling of the macula due to collection of fluid. Macula is the central part of retina on which the image of an object to be seen fall. Macula needs to be healthy to accomplish the clear vision of an object. Macular edema occurs due to diabetes mellitus, retinal vein occlusion, or inflammation, age-related macular degeneration where abnormal blood vessels leak beneath the macula. The most common medicine used in this injection are anti-vegf agents like ranibizumab, brolucizumab, aflibercept, faricimab, bevacizumab, or the steroids like triamcinolone acetonide, dexamethasone, or antibiotics. You may need an intravitreal injection because some eye diseases affect the retina and macula, which lie deep inside the eye. Eye drops and tablets often cannot reach these tissues in sufficient concentrations. By injecting the medicine directly into the vitreous cavity, the drug reaches the retina where it is needed most. The disease is at the back of the eye, and the most effective way to treat is to place the medicine as close to the disease as possible. Many a time, patients ask, is it a one-time treatment? Often no. Many retinal diseases require a series of injections according to the protocol of the medicine used. It has monthly or so loading dose followed by maintenance dose with long interval. The spacing of interval depends may be decided by OCT findings or improvement of vision, so to design treat and extend method or less frequently as and when required basis. Most patients report pressure rather than pain because anesthetic drops are used beforehand. The procedure usually takes only a few minutes. To be very honest, the injection is not completely sensation free, but most patients experience only a few seconds of mild discomfort. The procedure is generally much less painful than anticipated. Sources of discomfort during intravitreal injection are instillation of povidone iodine. Many patients report that the povidone iodine stings more than the needle itself. This is often the most unpleasant part of the procedure. Lead speculum is applied to expose the injection site. The speculum can cause a sensation of pressure, stressing, or discomfort, especially in anxious patients at the time of application. Though a hair-like 30-gauge needle is used after numbing the site of injection with topical anesthesia, patients usually feel mild pressure or a brief prick or a transient sharp sensation. Severe pain is almost unusual, but if it occurs at all, it should raise concern about inadequate anesthesia, scleral indentation, ciliary body irritation, or any other complication. In my practice, I use 0.4% oxybuprofen hydrochloride, one drop 3 times within 5 minutes, and I find it is adequate for most patients. Alternatively, 2% lidocaine gel 5 minutes before injection would ensure even better numbness. Cotton-tipped applicator soaked in 0.4% oxybuprofen hydrochloride is applied to injection site for focal anesthesia. After injection, patients most commonly say, I felt pressure only, or I felt a tiny pins only, or it was much easier than I expected. In my practice, I find that fear of pain is considerably greater than the actual pain experienced. After the first injection, patient's anxiety often decreases substantially because the procedure is usually easier than expected. In my hand, the patient usually does not develop redness or significant rise of intraocular pressure. I don't apply patch on the eye or any restriction, only not to rub or splash of water for 24 hours. Intravitreal injections are generally well tolerated with topical anesthesia. Most patients experience only mild transient discomfort, typically from the antiseptic preparation, lead speculum, or brief needle entry. Severe pain is uncommon and should prompt evaluation for inadequate anesthesia or procedural complications.